cardiovascular anesthesia in the Goldilocks zone. We are excited to welcome you during the EACTAIC Fellowship Seminars, Series 1, Episode 4, organized by the EACTAIC Education Committee in collaboration with the University of Bern, Switzerland, to learn more about the most important topics related to cardiovascular anesthesia, on Monday, October 24, 2022, at 18:00 to 19:40 Rome time. The University of Bern, Switzerland, supported the seminar episode. Do not miss it, and stay tuned. How to register. It is simple. Type or copy the link below to your browser. Enter your full name and surname to get the certificate of attendance. Please contact eactaic.seminar@aimgroup.eu if you do not receive your link 48 hours after the registration. Please note that registrations are only possible until 17:25 on October 24, 2022. All the registrations sent after that time will not be accepted. What's in it for me? After participating in this seminar episode, you will better understand. The evidence supports the preferred intraoperative fraction of inspired oxygen during cardiac surgery. The changes in cerebral flow during antegrade cerebral perfusion. Red blood cells, RBCs, transfusion threshold for cardiac surgery. The values of intraoperative TEE reassessment of preoperative echocardiographic findings to guide the right surgical decision for cardiac surgery. To know more about the program, the seminar's episode will be moderated by Dr. N. Cowart-Wilms and Dr. Gabor Erdos, Bern, Switzerland. The first talk will be on how much is just fine with fraction of inspired oxygen, by Dr. Dominic Gunsch. Afterward, Dr. Angela Levi's will talk about how much is just fine with cerebral flow during antegrade cerebral perfusion. The third speaker will be Dr. Daniel Gerber, who will discuss how much is just fine with RBC transfusion. Dr. Trevor Hershey will be the last speaker. He will discuss how much is just fine with intraoperative reassessment of preoperative echocardiography findings. Finally, do not miss to ask the faculty and exchange your experiences with them during the QA session. Meet the faculty. Dr. N. Cowart-Wilms. She is specialized in anesthesia in 2018 and stands as a senior doctor since 2020. She has special interests in perioperative coagulation management. Dr. Gabor Erdos. After various interims, he stands as a consultant since 2007 and the head of the adult and pediatric cardiovascular anesthesia since 2021 at Hospital. University Hospital, Bern, Switzerland. His research interests include perioperative hemostasis and transfusion, CNS monitoring and protection in cardiovascular surgery and anesthesia for thoracic aortic surgery, congenital heart disease, transcatheter and endovascular procedures. Dr. Dominic Gunsch. He started his subspecialization into cardiovascular anesthesia already in his final year as a resident and is now one of the senior attending cardiovascular anesthetists of the team. He covers the entire spectrum of procedures offered at Bern University Hospital. He has a broad research experience in cardiovascular imaging, including TOE and CMR, focusing on myocardial oxygenation and protection. Dr. Angela Levi's. After obtaining her anesthesiology and intensive care medicine certification, she recently completed the EACTAIC Fellowship in Cardiovascular and Thoracic Anesthesia at Bern University. Her particular interest in research focus on hemodynamic monitoring and targeted treatment of patients on cardiopulmonary bypass following cardiac arrest and resuscitation. Dr. Daniel Gerber. He is an anesthesiologist who specialized in cardiac and vascular anesthesia for patients of all age groups, including congenital heart diseases. He is a member of the transfusion board of the Insalzspital University Hospital. In addition to dealing with transfusion and coagulation management in the perioperative setting daily, he works as an emergency physician on a helicopter rescue service and is therefore confronted with acute bleeding in various scenarios. His scientific interests are the implementation of evidence-based medicine in the clinical routine of anesthesiology. Dr. Trevor Hershey. He started my anesthesiological training at the Burgerspital in Solothurn and then completed it at the Insalzspital Bern in 2019. Since 2020 he has been a permanent member of the cardiovascular anesthesia team at the Insalzspital. We look forward to welcome you.